So we are giving out 8 telehealth awards that folks were nominated probably 3 to 6 months ago, and they had to give support letters and justify why these individuals were chosen. And then after we award those, we have 3 poster winners. We had judges that scored them, so we will give those 3 awards as well. Our first award is the Trailblazer Award.
Caitlin and I co-founded Clemson Rural Health back in 2019. I needed a partner to do that. I'm not clinical, she is. And together we've been able to maneuver and create an initiative that's making a big impact in our state. Without her support and without her dedication to what she does, that would have been extremely difficult to make this work. So I'm very, very honored to be able to work with Caitlin on a daily basis and see her ideas come to action.
Most important thing to know about Caitlin is her passion. She is a passionate person and cares deeply about health, particularly rural health. And I should tell you that she's a 4-time graduate of Clemson University, so she just received her doctorate in nursing practice. And it's important to say that because her training, I think, helped develop her passion for what she does. She had training in developing nations as well as training in rural South Carolina. And that really drives what she does. So Caitlin wakes up in the morning thinking about rural health, and this is really beneficial to us at Clemson Rural Health as well. But it's because of that work she started to see a gap in what we were doing and the needs of how to reach rural populations.
For the last 2 years, Palmetto Care Connections has been working on implementing a telehealth platform throughout the state of South Carolina to make it available to healthcare providers all across the state to serve patients all across the state. Caitlin and Clemson Rural Health have been instrumental in helping us get the platform in place that would best serve these patients throughout these communities. Caitlin has certainly been a trailblazer in her ideas and things that she has put forward to help shape what the platform would look like. Caitlin and Clemson Rural Health and their team have worked very well at putting remote patient monitoring and incorporating that in to a holistic approach of taking care of their patients. So what remote patient monitoring allows her to do is send devices home with the patient that can allow her to see whatever treatment she's put in place. So that might mean medications, that might mean exercises, it might mean any litany of things, but it allows her to see in an instant the difference that is making.
So our Telehealth Trailblazer Award goes to Miss Caitlin Moore. You want to come up and get your award? And listen, we are all better people to know Caitlin because she is an amazing provider. We're going to come over and get a picture. Somebody forgot their phone. So now we have our Telehealth Innovator Award.
I feel that Dr. Galt is deserving of the Telehealth Innovator Award because he is a visionary. His vision was to ensure that the telehealth visits resembled clinic visits as much as possible. I think that he's definitely gold standard and he sets the bar very high. So without him, I don't know that we would have telehealth visits that we have today. With telehealth in the way that he has established everything, it allows patients to be seen in clinic once a year, and then when necessary, we're able to do virtual visits, which are gonna meet the standard of care that we would with a clinic visit as well. So he has definitely made a huge difference in the world of telehealth.
The way that Dr. Galt has been able to schedule and orient the virtual visits It really mimics an in-person visit as much as possible, which I think really increases the standard of a virtual visit that you might see in other offices. So we have a CMA that checks in the patient through a video. So they're seeing someone and they're greeted by someone that if they've been in our practice before, which with most of our virtual visits they have, they're greeted by someone that they know and they see that familiar face. The history and medications are reviewed, then they see the provider, and then before they leave, they're connected to the front desk, who they're also seeing our front desk workers on a video, and everything gets scheduled. So everything is done before they leave the virtual visit, just like it would be in the office, which I think is a much higher standard of care and something that Dr. Galt really pushed for when we were moving towards doing virtual visits.
He puts all his hard work and his thoughts into the patient care to make sure that they're very well taken care of and we find the reason behind their concerns. And he doesn't speed past things or rush things. He wants to really dig deep and find the cause of what's going on and do any steps he possibly can. And then digging deep into that telehealth and finding ways that it makes it feel more personal even when you're not face to face. So he definitely deserves this reward just because he wants to take the steps and make sure we do everything we can to make sure that the patients are well taken care of.
So our innovator, telehealth innovator award goes to Dr. Galt. Could you step up, please? Well, thank y'all for coming to get it from him. We appreciate it. Y'all get to take his picture. Okay, go right ahead.
Okay, so I'm Megan Hyatt. I'm one of the nurse practitioners that works with Dr. Galt. I've been with him for 7 years.
And I'm Claudina Castillo, and I've been with him for a little over 6 years. And I'm one of the pediatric nurse practitioners as well. We are honored to accept this award on behalf of Dr. Galt, who unfortunately could not be here today as he is presenting at another institution. As one of the nurse practitioners in his practice, I have had the privilege of working alongside him and witnessing his passion, dedication, and innovation that he has brought to the telehealth field. Dr. Galt has always been ahead of the curve when it comes to finding new ways to expand access to care. His visionary leadership has transformed how we serve patients, especially through telemedicine. He saw early on the potential of technology not just as a tool, but as a bridgeway to reach patients who otherwise might not have access to care. His work has gone beyond merely using telemedicine. He has revolutionized how we connect with our patients.
Dr. Galt has worked to model telemedicine visits to resemble in-person visits as much as possible, striving to ensure that patients and families feel that they are getting comprehensive and exceptional care. Through his efforts, we've improved the quality of care for so many individuals, particularly those in rural and underserved areas, and have been able to prevent gaps in care for patients all over the state of South Carolina. His commitment to improving healthcare access has been transformative. While Dr. Galt is not here to accept this award in person, I know he would say that this recognition is not just his, and is a reflection of the hard work of our entire team. We are proud to be a part of this movement to provide better and more equitable care. On behalf of Dr. Galt, thank you for this honor. We will continue this important work, and we're grateful to be a part of this shared mission. Thank you.
So our next award is a very special award. It is our Telehealth Pioneer Award, someone who has been doing telehealth for quite some time.
Bob Bank has truly been an incredible supporter of telehealth. He is truly a telehealth pioneer, and he was instrumental when we started the statewide ED telepsychiatry project. That project clearly was one of the largest projects undertaken in the history of the state, which then resulted as a prototype for a number of projects that came on after it within community across the care continuum. The Department of Mental Health provides yeoman service via telehealth to rural counties to be able to improve access to the under-resourced in the state of South Carolina. And Bob has been a part and parcel of that. So we're very proud of Bob and his contributions to the telehealth space. And congratulations on being this year's telehealth pioneer.
Dr. Bank came on as state medical director when we were still in the planning stage for the ED telepsychiatry consult program. And then as we got started, he seemed to really understand what we were doing. After that program got off the ground, there were a lot more programs that started up using telemedicine in a lot of other ways within the Department of Mental Health. And Dr. Bank was medical director when all of these programs got started.
Dr. Bob Bank has been in the forefront of the development and deployment of telehealth services in South Carolina, particularly in telepsychiatry. He has overseen the expansion of telehealth services at DMH, and they have become one of the most successful and largest telepsychiatry services in America. It is with pleasure that I congratulate you, Bob, on receiving the Telehealth Pioneer Award.
So you all know Dr. Bank is a very special guy, and they do a lot of telehealth and provide a lot of leadership for South Carolina. So Dr. Bank, would you come get your award? Do you want to say something?
Yeah.
Okay, go right ahead.
I don't want to make you hold that thing the whole time. That's all right. Well, when we started the emergency room telepsychiatry program in 2009, I never thought I would be at a conference where almost every single table has a telemedicine program. I mean, it's unbelievably successful and really makes me feel as if our initial vision has come to fruition. We've continued with this, and I was talking to my staff yesterday about our numbers for the last 5 years. If you put our emergency room telepsychiatry program together with all of the patients we see at our 16 mental health centers around the state by tele, in the last 5 years, that's 450,000 people, visits by psychiatrists. So I think that was pretty successful. And many thanks to all my supporters. Mira Narisimhan did all the research projects that really tell the tale of the benefits. And Jimmy McGilligan at the Telehealth Alliance, a great supporter. And many thanks to the legislators who have funded all this for all these years. So thank you very much.
Now for our telehealth program of excellence.
I'm so glad to be playing a small role in helping to recognize the stellar program known as iCare. Mental health, especially in South Carolina rural communities, is an epidemic problem, exacerbated because of lack of access to transportation, not to mention the number of professionals, providers in our rural regions. So by using telehealth, we're actually able to bring the provision of mental health care rather than expect someone to come to Columbia or Charleston, wherever it might be, to actually bring the care, bring the evaluation, and bring the treatment right to them.
The iCare psychiatry program has been around for almost a decade. It was designed to help deliver and meet mental health care gaps in rural, underserved areas of South Carolina. And it really has been an incredibly successful program. What it does, it prevents readmissions for folks that might be seen in an emergency situation, especially in behavioral health or mental health issues. We don't have enough mental health staffers now or anticipated in the future because of the shortage of those type of professionals. If we can get patients that need to be followed up after being seen in an emergency room in a very short time period, they can do it through telehealth versus in person. They can get seen in follow-up and markedly reduced readmissions to the healthcare system or revisits to the emergency department.
The state of South Carolina has seen over the last 2 years specifically an enormous increase in the demand for mental and behavioral health resources. When we don't have programs like the iCares program, those resources are sought out in our emergency departments, and it makes complex care that's not behavioral health compromised because the ERs get overrun. What this program does is gives access, routine access, to folks all across the state that wouldn't have access to this care and keeps them out of the emergency departments, leaving those resources there for the citizens of South Carolina when they're needed.
So our program of excellence is presented to the iCare team. And Dr. Narissaman is on our PCC board, and she is dedicated to telehealth, so we're very proud of her.
Should never ask a psychiatrist to speak. There is no health without mental health. And to me, when, obviously Bob talked about the ED telepsychiatry project that I got involved with almost 17 years ago, that in turn resulted in several lessons learned and the prototypes that we developed for primary care practice transformation of behavioral health being integrated into that. I developed a prototype, and then there was one individual in the South Carolina House of Representatives by the name of Merle Smith, who truly believed in what I was, clearly went on to showcase to him. He supported this venture, iCare, which also resulted in Tom Alexander from the Senate supporting it. So with their support, and you heard President Harris Pastidas at the University of South Carolina as the leader there, we clearly were able to work very closely with CareSouth, the federally qualified healthcare clinics. They were amazing partners to work with. Prisma Health, the rural clinics within Prisma Health, also kind of worked alongside us. And to me, iCare has, while psychiatry was a model, we were able to expand that into pediatrics, into OBGYN, and other specialties. So it's really grown by leaps and bounds. It was the cornerstone and the foundation for now the Center for Rural Health and Primary Care within the University of South Carolina School of Medicine. So I know that Bill Herb Kurtzman had to leave, but he said it's now bigger and better under him than it was under Merle Smith. I just wanted to make sure to mention that. I would be remiss if I did not thank my amazing team, some of whom are here today, many of whom aren't. But it's just their attitude of servitude to be able to deliver care at the doorstep of these patients, to be able to then use this platform as a fertile bed for training the next generation of leaders, and also looking at measuring outcomes, return on investment, making a business case. We've been able to do all of that across every program that we've been involved with. As they say, talent wins games, but in healthcare, it's teamwork, intelligence, servitude with gratitude, and humility. And to me, this is a legacy we leave behind for generations to come. Thank you very much for this honor.
Our next award is our Technology Champion Award.
Ability to do a video chat.
Matt Hyatt clearly is an exemplar of servitude, given the incredible service in rural health that he's done for the state of South Carolina. Matt comes from a rural county, a small community, and he truly understands the challenges that individuals within those counties do experience. And to me, even though he has been a healthcare professional in the IT realm, within the digital health space for the past 30 years or so, the unique talent that Matt has is clearly simplifying things, not being very techy when he talks about IT. His passion for improving access to care is just palpable. He's been instrumental via PCC to be able to expand the broadband consortia to more than 10 states, which has resulted in cost savings for healthcare providers, especially broadband costs in the millions. So Matt, congratulations on this award. Wish you the very best.
If you send a patient home,
Matt is wonderful to work with. He presents options to us and explains it in a very easy way. We are the Tri-County Commission on Alcohol and Drug Abuse. We serve Orangeburg, Bamberg, and Calhoun counties. What Matt does is kind of manages all of our IT for us and ensuring that we have the proper equipment that we need, the proper web connection that we need in order to be able to provide telehealth services. And Matt makes sure that we have bandwidth available and the technology in order to be able to provide those services. Having Matt come in and assure us that the technology that he's going to help bring to us is going to be HIPAA compliant, secure, protecting the confidentiality of the patients that we see. It really made me feel more comfortable about it and helped us ensure that what we were doing was not only in the best interest of the client and going to meet their needs, but it was also going to protect the client through that telehealth platform.
Matt really knows and understands rural communities from a firsthand experience. He has worked and grown up in a rural community his entire life. And he is very passionate and really believes that telehealth is a great way to increase access to care in these communities that have barriers, such as transportation. And Matt is always willing to go above and beyond to make sure that people feel comfortable using technology and that technology can be seen sometimes as a simple solution to a large problem. So this is a very special award for me to give out today because Matt and I have worked together for over 20 years, even before we started doing telehealth in 2010. So our Technology Champion Award goes to Mr. Matt Hyatt.
So those of you that know me know that I am not very comfortable with this, and I am very thankful to Kathy for putting up with me for 20 plus years. Thankful to our team that's in here, but mostly thankful to all of you. If it wasn't for what you do, I wouldn't have a need for me to do what I do. So thank you all very much.
So I think Miss Ashley, so this is another very special award. This is the Rick Foster Primary Care Telehealth Award that was established right after he passed a little over a year ago. And his daughter Ashley is going to announce the winner, right? So she wants to do this in memory of her dad, so it's very special. So this is, Are you going to play the video? Yes. So this is the Primary Care Telehealth Champion Award.
What's going on today?
The Rick Foster Primary Care Telehealth Champion Award is a very special award given to a special physician, Dr. Danette McElhaney, and it was created by our beloved Dr. Rick Foster, who passed away last year. And he created that in an effort to try to really identify primary care providers who went above and beyond to make sure that their patients had access to primary care in rural and underserved communities.
Dr. McElhaney really has a comprehensive practice in Bamberg County. She offers a multitude of resources that I think set her apart from the rest. She has a very strong focus on chronic care. She is a clinical pharmacist. In addition to telehealth, she does just a variety of things that really meet the comprehensive needs of folks in Bamberg.
Prior to the pandemic, we had started with school-based telehealth. So she's always kind of had the passion for how can we always incorporate more for the community. The pandemic really opened up a door where we were able to push not just school-based telehealth, but telehealth in general in the office. So we opened it up to our patients. We partnered with Palmetto Care Connections to get the platform to provide that service to our patients. She's always looking for another way that we can benefit our patients from the healthcare standard.
Dr. McElhaney has lived and worked in a rural community her entire life, and she is very infused into the community. She understands her patients and the lifestyle that a lot of times they have to live to be in a rural community. She has gone above and beyond to offer better access to health care through telehealth. She has hired a full-time nurse practitioner who does telehealth 5 days a week and provides it in the community and the surrounding areas.
Dr. McElhaney really has been a pioneer in rural telehealth. She's done fantastic work in Bamberg, working with a nurse practitioner, going into rural communities, working with local employers, and really offering a resource that they didn't have prior. The fact that she uses telehealth, she can see patients from all around the county and surrounding counties sometimes, and really break down the physical barrier of care.
She's very quality oriented. She wants to make sure that we're delivering the best possible care we can to our patients. She's genuinely dedicated in being the best provider she can and being an asset to the community, and anything we can bring to Bamberg and our patients, she absolutely tries her hardest to provide those services.
I know my dad loved working on the board with you, and it's my honor to present to you the Dr. Foster Telehealth Primary Care Champion Award.
Wow, I really don't know what to say. I'm always overwhelmed. Just amazed at where God has placed me, and I have to give him all the credit. He's taken me places that I never ever growing up would have thought I would have been. I'm thankful to my family, to my husband who's here with me today. I'm thankful to my staff. Without them to support me, I wouldn't be where I am. We couldn't do all the things we do. I grew up in a rural area and then moved on to a rural area, and it really means a lot to me that we're able to provide the best care to patients in rural areas who sometimes don't have the resources that or the ability to get places that you do in an urban environment. So I'm thankful for Dr. Foster. When he came up with this award last year, Kathy, after he passed, I called Kathy. I said, well, we've got to get this to Dr. Foster. I mean, it should be his. She said, well, Danette, he really wanted you to have it. And I said, well, no, this is not my year. I'll have another year. This is not my year. So I'm thankful to him. He was a great mentor to me. And Ashley, thank you so much. I know he's a great man. Thank you to PCC, to SDCA, to all the Office of Rural Health. I just get so much support, and I'm just so thankful for that.
And she's our board chairman, and you saw her do that. She was out of her comfort zone. She did the legislative panel earlier. She's getting really good at that kind of stuff. So this next one is also a very important award. It is the State Telehealth Champion Award that we've given out every year since we've been doing this for 12 years. And this individual has really led our state in telehealth. He's been very visionary, and a lot of what we do today, I think, is because of his vision.
Telehealth services were not new in South Carolina some years ago, but this innovative delivery model needed a champion who was strategically located and vitally interested in standing up a statewide effort. That champion was Dr. Patrick Colley. Through his efforts, securing initial funding and reoccurring funding to support what became the MUSC's Telehealth Center and the state's Telehealth Alliance. Both of these creations helped propel South Carolina to become one of the leading states in the nation in the use of telehealth. These entities helped us claim a spot on the national map, and Pat was the most responsible person using his vision to get this started.
Pat was among a handful of innovative, thoughtful leaders across the state who said this is the future. And we're able to get alignment with the state legislature and an opportunity to maybe develop pilot programs and maybe prove that this is something that could be game-changing or new in terms of delivery. And so Pat's been at every step of the way. At MUSC specifically, Pat has always been a champion and helped build the accountable structure and resources and talent to help bring this together. And I would say at the statewide level, the South Carolina Telehealth Alliance, that's something that he has been able to, along with other critical leaders, build the team to get people at the table, to get common vision, strategy, and purpose. And that's not a simple task. It was years to get to where there was generally alignment. I'm so excited because now where we are, we have a huge, I think, and very impactful future.
For me and for the work that our team has done and the work of the Telehealth Alliance, he has always been there, one, championing that this should happen and as a high priority for our state and for our health systems, but also making sure that we're brave and bold. Other health systems often come and visit us, or we talk in on national venues to talk about how we've done so much with telehealth, and we talk about the importance of leadership buy-in, and everybody nods and agrees, but I don't think they really understand what it actually means to have a truly engaged and visionary leader that says, you've done a great job, this is more than ever, and it's not enough, and we're gonna have to do more. There's a lot of priorities in healthcare. There's a competitive health space, there is a lot of needs, a lot of demands, but he always saw how important virtual care was gonna be. And then when the pandemic hit, we were ready, and post-pandemic, the bar is raised ever more, and those mountains that we have to climb are ever higher, but we're well-resourced to do it, and we know we have the support and the prioritization to keep going.
So our State Telehealth Champion Award goes to Dr. Pat Cawley.
Well, I'll be real brief. I just really want to thank three groups. Having seen this from the beginning, and if you're here this morning, I told the story of when the legislature first came to MUSC and said we want to do this, Dr. Greenberg came to a group of leaders at MUSC and said, who wants this? Who's going to run it with it? And I was like the last person raising their hand. So first and foremost, this would have never gotten where it got without the investment and the vision of the legislature. I can't point that out enough. We would have never taken that first step, but you all saw something and happy to take that step with you. So thank you. The second group I just would acknowledge is the MUSC team. There's a lot of code words in that presentation there, and I appreciate the MUSC team. They know I'm going to call them. I can call them at 2 o'clock in the morning because that's what I like to do sometimes. But the team has been incredibly responsive, and right in the beginning, and the other thing that the legislature laid out early, they gave us funding, but they also said it must be collaborative. And we actually used that to develop something unique across the state. I remember early on we were arguing about hardware. Everybody wanted their own hardware, and we got past that. And I kept talking to the MUSC team about that, and they didn't understand in the beginning why that was important. But eventually they got there, and I want to thank the team for bearing with me on that because I think we got something better. And last and maybe most important is to thank everybody in the room. I do a lot of traveling around the United States. I sit on a lot of different boards, and I hear this all the time about what are you guys doing with telehealth in South Carolina? How'd you do that? And our outcomes are there. I mean, we have tremendous outcomes in stroke, in school-based care, and then 1,000 other areas. And they're always asking, and we really have something truly special here. And everybody in this room, you know, whether you're a legislator or whether you're a technician or a clinician, you believe in something that, and you came together, and we really have something special in South Carolina. So I just want to thank everybody in this room, because you're building something truly remarkable. And I think, if you heard me at my comments this morning, I think the next 10 years are going to be really challenging, and we're going to really thank ourselves that we had telehealth to lean back on when we're dealing with the number of patients we have in the future. So once again, thank you for this award once again.
So our last award before we get to the posters is the Legislative Champion Award for Telehealth.
Have conversations and take...
Chairwoman Davis is amazing when it comes to telehealth and all the things that she's done over the last 2 years that, as the chairwoman of 3M. She's a fantastic leader. She's somebody that we can rely on and get behind. Just an amazing, passionate person.
Celeste made it very clear to me and everyone on the committee, I want to move the needle forward in healthcare in terms of access and how people are being able to have healthcare delivered to them in every nook and cranny of the state. People who live in rural areas should not be treated any differently than people who live in the suburban, urban areas. And so it's been incredible to watch Celeste bring together all stakeholders and have difficult conversations that all centered around the patient.
I think a lot of people serve because they care about people, and Celeste Davis absolutely cares about people. She understands the neighborhoods and communities that she represents. Not everyone can just jump in a car and go here and go there, and not everyone has the same access and abilities to have their health care needs taken care of. It's never been about what Celeste and her kids and her husband and her family can do, but about all the people that she's met throughout Berkeley County. How can we best get people health care? And that takes innovative and new strategies that match today, you know, not necessarily 10 and 20, 30 years ago. So it's a passion of hers to bring health care to those that need it and get the medical profession, you know, what they need to be able to make that happen.
She cares very much about the residents of the state, and she spends all of her time dedicated to the residents of the state.
When I think about some of the leadership traits that Representative Celeste Davis exemplifies, I wrote down a few things that come right to mind. Words like integrity, accountability, transparency, honesty, respect, and problem solver. Celeste is consistently a good leader and just a genuine good person with a huge heart who at the end of the day wants to do the right thing and look for ways to lift every party up involved, always looking for a win-win in every situation.
I think that this was a success because everyone loves Celeste. She's a team player. She knows that being at the State House is a long game. You got to build up seniority. You got to have colleagues that'll buy into things. And she seems to be able to work really well with not only her Republican colleagues, but everyone across the aisle. This is not a political subject. Everybody of any political affiliation, race, you name it, benefits from something like this. Clearly, telehealth is one of her passions. This is what's in her. And those are the advocates that you want on these committees to it.
So she has become, I've gotten to know her the past couple years. She was very instrumental in helping us get the telehealth modernization bill passed last year. We could not have done that without her. She is a force to be reckoned with. Do not miss that when you see her petite self. So we would love to give this award to Representative Celeste Davis.
Gosh, I don't even know what to say. Thank you,
for the award. Thank you for the kind words. Thank you for the encouraging words. I'm here because I decided I wanted to help. I wanted to help in the state legislature. I wanted to help people get health care. I wanted to help on a lot of different levels. But I mean, I'm here to help, and that does not necessarily mean that I do much of anything at all, right? I mean, you guys are the ones that are out there every day working to provide better access to health care, quality health care, to every person here in South Carolina. I cannot think of a more worthy purpose for you to live day by day. So, thank you. I'd like to thank my husband, too. Without him, I would not be here. Without the people that I work with, I wouldn't be here. So thank you again for what you do every day. I appreciate you so very much.
So let's give another round of applause to all of our award winners, can we? So those are all of the awards that were nominated, but we had 18 posters this year, which is really phenomenal, and they were really great. And we had a panel of judges. And so I would like to award our programmatic poster award to Discreet Food Insecurity Screening in a Rural Pediatric Clinic with Resource Sharing. Miss Christy Irons and Chad, if y'all could come up. Are you here? Have they gone, maybe? Okay, we will make sure they get this award.
Let's give them an applause.
Let's give them applause. Listen, I can't see a thing without my glasses, so. Our next award is our scientific award, and that was chosen for the emergency department utilization by South Carolina patients with type 2 diabetes, a needs assessment to infirm primary care access and telehealth improvement by Beverly Holmes. Are you here, Beverly? Okay. They did not stay till the end of the, so that is for sure. Now this is a very special one because this is the Voters' Choice Award. And it is presented to, and this is a very phenomenal program if you don't know anything about it, the Community Paramedic, how a rural primary care office and an EMS agency are working toward redefining healthcare delivery in South Carolina. Mr. Graham Sims. Congratulations.
Thank you.
Would you like to say anything?
I just want to thank everybody that took the time to check out my poster and listen to me ramble on a little bit about the program. Exciting to be part of this and kind of augment telehealth, learn all sorts of different setups that you guys have. It's been a great experience so far, and this is exciting too.
Congratulations. Thank you.
So that is it for our awards, and we are